Yeah, so thank you for having me here. So Lynne Chou O'Keefe, founder of Define Ventures. We're a sector-focused fund only in digital health. I was at Kleiner Perkins for 5.5 years before that, so great to be here. And you wanted us just intros, or?
Yes. Yeah, intros
All right.
is good. That's good. That's fine. Oh, that's another.
So,
Sure.
so philosophy, yeah, I'll keep it really quick because we have a big panel here. So again, sector focus in digital health, can invest in seed, Series A and Series B companies, and really just sector focus. So no therapeutics, no device, no tech, just digital health.
Excellent. Hi, I'm Eva Borden, and I am with Cigna, which is a payer health insurance company. And one of the reasons I'm here today is we care very much about the mind-body connection, and a behavioral health focus has become very, very important, including the technology pieces. So I'm here to represent how would a payer think about this space.
Alex Morgan. I guess where to start. So I'm an MD, PhD by training and a machine learning researcher and once a physicist. So have very active portfolio across everything from a rocket company to fusion technology to foods. But we're certainly very active in life science and biotech. Again, everything from AI-driven therapeutics discovery through to health service and delivery. Obviously, everyone here has a human brain and has mental and emotional components to that. So the addressable market in mental and emotional health is enormous, but it's also a very huge and very serious unmet need, has been raised a few times already. And it's an area where technology has not, until very recently, started to make significant strides. And I think that's the whole context for the rest of the discussion. So I guess I'll stop now, because then we can kind of get into the color. It's a wonderful opportunity in a way that we can affect change and help people. And then many people here have a business side to what they do, so it's also a business opportunity.
Great, this is a diverse panel. Hi everyone, I'm Danielle Ramo. I am a clinical psychologist by training, and I was on faculty here in the Department of Psychiatry until August of this year when I joined Hopelab. I'm trying to figure out if I'm the only person on a panel tonight with a .org in my email address, but I do indeed have a .org at the end of my email address. We're a 501c3 organization that's part of the Ometeor group of companies, where we partner with organizations that are building technological tools to support adolescent health and emotional well-being. So we bring design, we have strategy expertise, and I lead a team of behavioral scientists that evaluate the efficacy of the tools that we co-design with young people and then partner with startups and also 501c3 organizations to get into the hands of young people. I can talk a little bit about our focus when we get to that point. Does that make sense? Or I can now.
Blake?
So we're building a tool now to address loneliness in college students. We're also we've got a chat bot on Facebook to deliver positive psychology skills to adolescent young adult cancer survivors. And we've built an app in the space of young parents for the nurse-family partnership to support goal setting among young moms.
Hi everyone, I'm Blake Wu. I'm an investor at NEA. Thank you, Bambi and Archana, for hosting the panel. NEA is one of the world's largest venture capital firms. We invest in two broad areas. It's going to sound very broad: technology and healthcare. I sit on our healthcare investment team. I focus on our healthcare services and our healthcare IT investing strategies.
So to Matthew's point, the $200 billion, and to our point, $200 billion or our slide anyway, spent on mental health. That's pretty broad. So where do you find most interesting to invest? So across the spectrum. So sort of lightweight solutions, as Alex, you alluded to, that everybody has some sort of mental problem, or is it more those people with addictions, opioid crisis, or comorbidities? So where across the spectrum do you want to invest, or do you think it's promising to invest? And then what are you focused on, more therapy-centric or digital-centric solutions? So that's kind of an open-ended question for everybody.
Yeah, and we do see investment of course, the venture fund, but also Cigna, being a pair. I think that investing into that also sets a culture of care that, your members are receiving. So if you can, yeah.
Thank you. So I'll talk a little bit about why is it that we would choose to invest in this space. So when you mentioned from the, is it the perspective of, are you going to go for the general population, or do we care more about the overall impact? So here's what I would say. When we get a chance to meet with employers, they're going to say, where are my dollars going? And for the most part, even though you see your dollars going on the chart up there, they're going to say, I see most of my dollars going to my cancers, to my oncologies, to my maternities, et cetera. And so there was a number of years where no one actually talked about behavioral health because it wasn't important until we started breaking down, and this goes to where I would say from an investment perspective, until you started breaking down and saying I can have two people who look the same medically. If one has a behavioral health comorbidity, that person will cost 2 to 3 times more. Now you're speaking a language that employers appreciate. And so when I think about the types of places we want to invest and put money into, it's how do I help those people who have those comorbidities? Because for as much as we saw the dollars on the page, there's a huge amount of medical dollars that sit behind it. And that's actually what we're trying to drive and impact.
Yeah, I mean, I've thought about the problem in 3 buckets: is access, quality, and cost. And for me, in terms of when I think, and we'll get more into this in mental behavioral 1.0 companies, which that wave happened about 2 years ago, there was a flurry, and we know probably all of those names. When we think about Joyable, Lyra, Quartet, et cetera, what wasn't
Quartet is
completely
here.
solved for me was this. And this is exactly why, to get real scale in this industry and to help as many people as I think we want to do, is we have to find a solution that has true cost implications and ROI for both employers, payers, and providers. And so I think that is the crux. And when I saw things from an ROI standpoint, I couldn't find any companies that had short-term ROI. It was all long-term, and it was with comorbid conditions, which really has a very different implication if you think about the solution sets that are built around what you were saying, Eva, is really about coordination with your PCP, coordinated care with your mental behavioral health clinicians, and a very sick population that might have diabetes, hypertension, you name it, in addition to mental behavioral health. And so that was the crux for me as an investor on why on kind of 1.0 we didn't really go forward. And we'll get into other things and where I have invested, and we'll talk about that later. But I just wanted to piggyback off that point because that is a very critical point of what you just said.
Well, I can. So, I think generally, I try not. There are lots of different areas where we have sort of interest and think that there are opportunities. I think mental behavioral health is a broad enough area that there's lots of interest. Typically, I focus on individual teams and technologies in a particular company, and not necessarily say I'm looking for something in this space, because it's often about the actual team. So I don't know if I would. People come to me and ask, what spaces, and it's more we're looking for excellent teams and excellent technology. Some of the companies that we have invested in actually follow on the thesis of difficulty in actually measuring endpoint and measurement-driven care as being a key driver of improvement. And a company that's sitting right there, I think you'll hear from later, is Ellipsis, which is building and has built voice-based biomarkers for mental and behavioral state. And that's a great way of basically, you think in physical medicine, again, going back to William Osler, father of American internal medicine, actually Canadian-British, you treat the patient, not the disease. And that's true across medicine. So it's very important to remember that this is tied up in everything in health and wellness. If you can't measure something, it's very hard to improve that process. And so things like a voice-based biomarker for mental and emotional state and wellness is a key component, I think, of the future of healthcare. We invested in Ginger, and unfortunately the CEO's out of town and wasn't able to come tonight. But they are using your mobile device, which you're addicted to, that we heard about before, in your pocket to actually help track your emotional and behavioral state and build a mental health delivery care system on top of that. We have done investments actually in therapeutics in this space. So there's a company in Sweden called Flow Neuroscience, which is doing transcranial electric stimulation for anxiety and depression. They're a pretty interesting company. We're also very active in sleep. And again, kind of returning, that's a key component to mental health and wellness. And we have investors in 8, which is a smart mattress, but a very interesting company called Stim Science with Matt Walker, who wrote a book that many people may have read about why we sleep. And they're doing, I actually maybe can't tell you what they're doing, but he's working with some electrical engineers in Berkeley. And I think that'll be a very interesting product when it launches.
So Alex, I just want to touch on that. So because we touched on diagnostics in the prior panel, right? I mean, we're saying it's a big problem, whereas in the last event we had on mental health, that wasn't, you weren't there, but it wasn't the problem, it was the treatments. And I kept saying that, wait a second, we can't have the treatments if we can't diagnose. Not only that, if we don't know what we're diagnosing, and that's a starting point. And so you've invested in Ginger.io and Ellipsis Health. At what point will we get to the doctor's office? How many years out will we be able to go there and get, here's your blood pressure, here's your,
so
and
Ellipsis
here's your
will
other.
tell you that they're already deployed in some places actually tracking people. Ginger is already working with some employers and people in organizations, many of which in the city are getting access to mental health services through Ginger. So I think there are technologies that are deployed. I think many of these things look very shallowly linear, but even an exponential function looks shallowly linear at first until it becomes exponential. You don't realize that until retrospect. So I think there are opportunities here. People ask oftentimes, like, what is happening in this market? Can you predict the future? I don't claim to be able to predict things. Like, we can see opportunities and we can try to enable and set teams up to try to get there. It's a matter of there's execution risk, there's timing risk, and sometimes the platforms aren't there. But I think many of there are many drivers in the overall space that I think enable the opportunity. And I guess I'm hogging time, so let me stop. But an example would be, as we move to value-based care and capitated systems, incentives start to align. As we have more and more channels for various kinds of care delivery, things like addiction to a device in your pocket that has a lot of sensors. You know, your mobile device knows much more about your mental state than someone that goes to talk to you for 50 minutes once a week. It knows where you got up, when you went to bed, did you go to your house, are you in a bar at 3 in the morning? These are important things. Those channels will provide
It
opportunities
knows
that
things
didn't
that
exist.
you don't want anyone to know.
Yeah,
right?
are you seeking a dopaminergic surge for taking that out of your pocket? What
You're
does that mean?
nagging mom in your pocket, basically.
Well, so there's timing that there are a set of incentives are aligning. There's also increased awareness. We have a lot of opportunities. So let me stop. But I think there are a lot of external forces and external changes that are creating channels and incentives to drive innovation and improvement.
Got it. I think Blake hasn't spoken about the companies he's in.
Yeah.
Yeah.
Danielle, sorry
Go
to
ahead.
interrupt.
No, that's okay.
And so we were very thematic investors in general. And so the biggest thing that we invest behind, and Alex touched on it briefly, is the shift and the transition from a fee-for-service-based system to a value-based care system. And so in value, you have to address, obviously, the underlying health of the patient. And obviously, one of the big underlying themes that we consistently see, not only on the payer side, but in the employer side, is underlying comorbidities, especially in mental health. And so for us, we tend to be a little bit more focused on either services models or tech-enabled services model. Healthcare still remains a people-focused business, and so for us, we aren't specifically focused on technology-only approaches to the problem. We still feel like the clinician needs to be involved and be the quarterback of care, and so that's the way we look at things, but obviously we've seen a proliferation of different models across the spectrum.
Yeah, and I would kind of second that, and also because Cigna is sitting here, and you talked about how you looked at behavioral health as a separate line item for the payers and employers. Presenteeism and absenteeism became the reason why EAP became a solution, and it was a standalone solution away from the medical benefits. And we saw that the impact is not as great, the engagement is not as great, and the transition to long-term care is not that great. And so having those standalone solutions that are independent of the medical benefit journey do carry a lot of challenges that do not integrate into the trusted source. That could be the primary care or the care provider, in a way.
So I guess on top of that is, how do we get and I think it's Quartet Health, you wrote a blog, Dave, there's a blog on your site that said, 70% of all the prescription medication antidepressants come from PHPs. And so how do we get, since, and maybe some of these are more sort of the lighter touch like folks, right, who are just going down that spectrum of being anxious or, stressed out. But how do we equip the providers to actually, how do we get access? I mean, where everybody's been aggregating all these therapists, getting all of these, digital technologies together, but that's not access, right? You need to push it out. How are we helping these PHPs?
It's the PCP dilemma,
Yeah,
right?
so-
The primary care physician dilemma, in which you don't have the tools, the time, and the education.
So how do we
to deliver
how do we
it.
help her?
So we have there could speak to companies that we're invested in. So we do have care delivery models, Forward Clinic, QBio, Iora Clinic, that are trying various things, some high-end with a view to becoming low-end, some starting with low, high-risk patients like Las Vegas casino workers who are very high-risk, terrible lifestyle, right? I think I would respond somewhat negatively to equating availability of pharmacotherapy at scale with a healthy healthcare system. So I'm going to have a little thing, and anyone here, you should never discontinue any medication given you a private provider, no family member. However, if you have a situation where in some population, 10 to 15% of youth are diagnosed with ADHD and treated with very powerful psychoactive substances, it is not an indication that I think a system works. If you read, Marcia Engel, who was New England Journal of Medicine editor, wrote a review of Emperor's New Mind in the DSM, and there's a great article that you can reference that talks about many of the issues in Japan is a great example. Methamphetamine was discovered in Japan. They have the longest experience understanding it, and Adderall is totally illegal in Japan, even with a doctor's prescription, because of the understanding of the risk. You can't go there in the U.S. If you're traveling to Japan and you have an Adderall prescription, don't do that. These are dangerous medications given out like candy. If you look at the research that's been on a lot of antidepressives, there are a lot of trends that, for example, if you're in an antidepressive trial, many of the patients, in fact, all of the patients turn out to be able to unblind themselves to the placebo group. And if you know that you were getting a treatment that affected your feeling, it's very hard to get a sense that that actually is the significant benefit that you're obtaining. Now, there are lots of wonderful things in antipsychotics that are like magic in many patients with schizophrenia, and they've helped many people. But the rate at which we're giving out medications where I think the supporting evidence for efficacy is not sufficient is, I think, a huge scandal, and will perhaps, if I were to short any industry, and I don't know the time scale in the decades ahead, it may be like the prescription epidemic with opioids, and that we will see an issue in the decades ahead that we're terribly abusing our citizens by pushing pharmacotherapy. So when you said about PCPs giving medication, I want to say that that's not equating with goodness.
Oh, we are totally,
I mean, if you think-
what we're saying is that's the
Yeah.
bad, that's the poor, and
It's-
we totally agree, that's poor incentive. The
Yes.
problem is PCPs don't have time, and they have an ROI because it comes down from their health plans and
Yes.
comes from their insurer that says we want evidence. And so they just don't have time, so they have to push these medications. We are not for that. In fact, that's why this entire salon is. So we're right there with you, and
We're
Danielle's
right there
looking
with
like
you,
she
yes.
has so much to
It's
say
actually
about
not
this
related to my
opioid
work at
crisis.
Hopelab, but related to my work as a clinical psychologist, is that a lot of what we know works for adolescent mental health problems in the area of behavioral interventions work as well as or better than medications.
Yes.
The
Yeah.
doozy, which I think everybody on this panel and probably in the room knows, is that you have to engage. It often takes a person. We have not automated delivery of CBT or DBT for adolescents or adults quite yet. We haven't figured out how to design the tools well enough to make them stick long enough for people to have lasting and measurable change on their mental health. And when you're talking about addiction, which is the area of research that I conducted for 15 years before coming to Hopelab, you have this extra and different biological component in that it's pretty hard to go to treatment when you're craving the heck out of that thing you're addicted to, right? And so that's where opportunity comes up, and this is not around PHPs, but this is where opportunity comes up around that thing in your pocket, and you see, maybe your phone knows that you're craving before. Well, you're craving, but before you're willing to address it. And with adolescents, which is the space that we're in at Hopelab, one of the biggest challenges for us is that most startups that we meet with would love, and honestly, sometimes their heart leads them to want to work with adolescents in a space like ADHD, for example, but they can't pay. And it's really a challenge. So they end up pivoting even when they want to go there first. And we see the first trials end up being in adults, and that's been a huge challenge. So we try to partner with organizations to maybe think about how, because we're driven by impact and not ROI as an organization, we can work with someone who actually wants to make change in adolescence or move into an adolescent market. So that's an opportunity. And if there is anyone in the audience thinking about getting into the adolescent market, you can come talk to me after.
It's an important market. But Lynne, so we're all for trying to alleviate this crisis, this opioid psychotropic crisis, right? And so what digital therapeutics are you investing in to help that? Or are you already seeing that helping?
Yeah, I mean, I think we have to attack this on many levels. And I think, Bambi, when you and I talked before this, I was kind of coming up with, I come back to, I think any solution, I actually maybe stand on the opposite side from some comments that have been made. I don't think it's just technology and a smart team. You have to absolutely understand the healthcare system as an ecosystem and as a business, and then create technology as an enabler around that. I think this is where we get in trouble with digital health, and I will not go on that tirade, but when we think technology solves everything, that is where things will not scale. And I think we can all believe that at the heart of why we are in digital health, because digital health is so hard to innovate in, is because we want to impact people and we want things at scale. So I look through everything within that lens, and that's why it has to solve access, it has to solve quality, and it has to solve cost. That's the only way I believe that we're going to have payers such as Cigna and others scale these products, scale these services that we're inventing to really affect the millions of people that need this. So point number one. Point number two is kind of how I think about it. And I think startups are doing it at very different levels. So I think there are solutions that are more traditional. I think either the individual themselves. So you've talked about CBTs, et cetera. We've seen a slew of companies in what I call mental health 1.0 around that, or just with traditional physician relationships with the individual via telemedicine, or how we want to say. I think the second layer we have to think about is the provider to provider interaction, and that's what you're talking about. I think sometimes why PCPs, at no fault of their own, is they want to help them. They don't have enough time, and they don't have enough clinicians that are specialized in this to actually have the consultations, to actually have the networks, because there aren't enough clinicians in this space. Now, I think we can solve some of those access problems via telemedicine and otherwise, but still we have a small base of clinicians, so we need to develop and grow that base overall. But there's a whole class of companies, I'd put Quartet in that milieu of physician to physician, getting the right network and getting people the right care. And then there's a whole nother, I think, again, basis as well, is what I'm now calling community care. And that's actually the investment that I just made 2 weeks ago to this day in a company called Unite Us. And you're going to say, well, why? That's a mental behavioral health company, but they are trying to solve that. And what they're trying to do is really become the network layer for all community service, which includes housing, it includes food, it includes mental behavioral health. It's making sure that we understand as a healthcare system where you're going to get community services. And for the disenfranchised population, which a lot of this is, if we think about, is where they're doing this, because social determinants of health actually is 60% of your healthcare. It's not your genomics. It's not what happens in the clinician's office. It's really the social determinants of health. So Unite Us is actually creating the network layer around the social determinants of health, of which mental behavioral health is one of those. So they're really tackling what I call community care around this. So we need the individual, we need the physicians connected to one another, and then we also need the community connected to each other around this issue.
And what's the business model around the community? Who pays for that?
So the actual community service providers, as well as the large providers as well. So companies like Intermountain provide large provider systems. So as you know, even Kaiser has said that they need to declare the end of homelessness in the Oakland community as part of one of their initiatives. And United Healthcare has also said that they're thinking again about bundled payments around the social determinants of health. So that is kind of, I just want to note a part of this conversation that I think is really going to help solve this problem as well.
Can I just echo on that piece that you're saying about the social determinants of health? Because as you described, you've got the behavioral health piece, but there's the social determinants piece becomes so critically important. And it's oftentimes, as I've met with different clients, it gets very dismissed as, oh, that's the Medicaid population. That's them over there. They're not my employees. And I was meeting with a group of about 12 clients around the room who had, let's say, 50,000 plus employees. And we were talking about a zip code in southern Chicago. The zip code in southern Chicago has pretty high murder rates, very traumatic type area. So just growing up in this zip code oftentimes drives PTSD, trauma, et cetera. And it's interesting because as I described it, you could sit there and say, oh, well, I'm so glad you're helping them. And across the 10 or 12 clients, I was able to pause and say, I just need you to know 8 of you have 50 or more of your people living in that zip code. It's not a them problem, it's an all of us problem. And it's hugely important in terms of, if I go back to what does it ultimately drive, the biggest spend that it's in the end going to drive is going to be that medical spend.
We have a few minutes, so if anybody has a couple questions. I do want to just ask one question for everybody here, though, because Eva, you kind of brought it up, and so did you, Lynn, but you said something about this affects everyone. And Alex, actually, you brought it up, is that so mental health is everyone's problem, like at various degrees. And so one of the mental health 1.0 was like a Headspace or a Calm, right? But they're going the light touch thing. But if they're a $1 billion company, at least last reported, they're a $1 billion company, and you kind of think like, well, yeah, actually that makes sense because it's super light touch, it's totally dumbed down, it's totally mindless, but it's useful to some people, right? And they're $1 billion, and so is the opportunity, and yet at the same time we're seeing companies like Lantern and Enjoyable and MyStrength consolidated, right? Trying to be hard CBT, validated type of products. And here we have something super light touch, but it's going out there and it's touching people in a very lightweight way. But then the 80% of people who are not really on the spectrum, but then you could use that to start screening them to get to the 20%. Maybe that is a good model. Maybe we should start using more of a lightweight, light touch thing just to get adoption. Thoughts on that?
Well, and I think I almost want to add the question to why is there so much consolidation? Are we failing these companies too early? We're not letting them bake their model and asking the outcome question a little too early? Or they're truly not the right solution and we're just throwing solutions to the wall and they're not sticking, and maybe it is to go through the clinical pathway the answer. So those are questions that we have around the current landscape that we are seeing of the lightweight and the high intensity matchmaking. Yeah.
So I'll just add one comment, at least from the way that we think about it at Cigna. It's not an or. It's not a light touch or a clinical model or a diagnostic model or, and I think that's a really important piece that when I think about, we've got 14 million customers who access our behavioral health care. They all need very different things. And so it's actually how do we take the best of all of them to bring it together to offer. So I don't think that I can dismiss the light touch or say it needs to be in exchange for another. They all have, they have their respective places. From an investor standpoint,
where do you come in and get that Trojan horse of adoption? It seems like they've gotten that adoption.
So I think this is also true. You can have a business that has a little bit of value out of many customers or a lot of value out of fewer customers, and both multiply out to the same thing, right? Or you can be an app or you can be a provider organization that may see fewer people, and I think both succeed. And this is healthcare's $3 trillion a year of spending. There are opportunity for thousands of billion-dollar businesses. So there's it's essentially effectively unbounded. I don't think when you talk about valuation, unless you're an investor in a company, it's hard to comment in a privately held entity what that means. Valuations are often about fractional ownership and all kinds of other things and strategic angling. And so it's not the same thing as a kind of something in a marketplace for capital, a publicly traded company. So I don't know if it's worth commenting on things like valuation, which you sort of hinted about, like how these companies are valued. it's the decision of, frankly, a handful of people at the end of the day, often in some of these limited conditions, which is fine. But I think both play a role. I think if companies don't work out, these are very high-risk endeavors, and so lots of them aren't going to work out. I don't think that's necessarily signaling. There are lots of companies that tried to be e-commerce companies. There's only one Amazon. There's still opportunities out there. Just because companies haven't succeeded doesn't mean there aren't breakthrough opportunities pending. No. I think these are just generally true things. I don't think that has anything to do with mental and behavioral health.
Well, I think from an
Kind of
investor
in startups
standpoint,
and new companies in large spaces.
Yeah. But
All
I mean,
these
if you
dynamics
look at
are
it
true.
and try to think of it from an exit standpoint, so I look at it sometimes and think some of these mental health apps on kind of the lighter weight side is kind of like the new weight loss industry. And if you look at it, it's extremely fragmented, but it's a $70 billion industry, so that's good. It's huge. But a couple of them, the couple of unicorns, are only $1 billion, and it's been a weight loss industry.
it's still
So
early
I'm
days.
just curious, like, how do you think, like, Calm is $1 billion, maybe it stays $1 billion, or
Lots of
maybe
companies
it's a
start out
bigger-
doing one thing and then stack on.
Yeah,
Stryker sold a couple bone saws, and now they're a billion-dollar medical device company. So if someone came in and said, "I'm going to build a bone saw, and that's my company," I don't think many Silicon Valley investors would be very enthusiastic about that model, because you can't predict the future. And they had a certain
I get it.
trajectory that wasn't super fast, but you don't know. And if you have a user base that loves your product, there's a lot of places you can take that. So I wouldn't underestimate where people can take their companies that look modest now. And again, I'll return to what I said before. Lots of things look shallowly linear that are actually the leading edge of an exponential.
How do you advise your investment to continue sustaining effort, or now pivot, or now consolidate? What kind of outcomes here?
I've spoken a lot. Don't look at me. There are a lot of other people
patient are
here.
you? How patient are you with your companies, especially behavioral health being a soft endpoint that you're looking at, and maybe there is no endpoint? What are the outcomes and questions you ask in your board meetings?
We have the strongest record in
wrapping this up. You just,
CB
like,
Insights
opened
for
up an
follow-on
entire-
investment, and have invested in lots of technologies in spaces like energy and rocket. Like we have rocket labs that do take a long time. There's kind of a minimum size to even be market viable, and so some of these things that are trying to be profoundly disruptive can take quite a long time. So everything is very context dependent then on individual team and space.
We have to wrap this up, but Blake was like you're just so respectful. You're just sitting there waiting. But you've invested in a cool company called Robot. So talk a little bit about that. I think that's actually a pretty cool way to kind of interact with people and really get. In fact, I have Robot, and it's constantly like, "Do you even want to talk to me anymore?" And I'm just like, "I'm really busy," but I love it. It's great. It's been
Sure. And to address your last question, Archana, so if you look at our portfolio, actually what we think is representative of that trend is our average hold period in our technology portfolio is 4.5 years. Our average holding period in our healthcare IT portfolio is 10.5 years. And so it's more than double. And so we understand that in certain instances, it can take much longer to build a truly transformational company in healthcare because of all the different existing stakeholders that are there. Wobot's a good example. We invested in that company very early. It's founded by 2 clinically trained psychiatrists out of Stanford. And so it is a CBT solution. We don't, and this is really important, because it was founded by clinicians, we're not seeking to replace clinicians. We're seeking to support existing clinicians in their workflow with their patients. And Wobot is a solution that can be given to patients in between their inpatient or in-person visits with their psychiatrist, or to continue CBT lessons that are prescribed by their psychiatrist. So it's a really important solution that is supporting existing frameworks within healthcare that are being delivered by clinicians.
Are psychiatrists being much more sort of measured on their, Archana and I talked about this, you get that person on a steady state on medication and they're fine, check in with me 6 months from now, but are they actually measured on when that person actually drops off on their medications? Are you seeing that at all?
Yeah, so Wobot tracks patients very, very closely, and so we have a medication adherence component, but I will say, of course, it is a PRO, it's a patient-reported outcome, and so there's a certain amount of noise in the input. It depends on the patient, of course, to input that information. And so, to your point, and the earlier addressing points around engagement and building an app, that drives, sustained engagement. That's a really important piece of what Wobot has done.
And I think, Danielle, I'm going to, because you have the mic, I'll make that yours last, and then we have Anthony, who's going to send everyone off to the break. So, okay, we have one question we have to, but Danielle, you can just come stand over here.
I was just going to say that the thing we look for at Hopelab, and that I hope everyone here is also looking for, is measurable difference on outcomes that matter to users, and of course to payers as well. But it's not only what's the funding model, or what's the market structure, what's the ROI for any given tool, but it's also, will use of this thing actually affect change in given individuals, right? So I can pay $100 a year for Headspace, and I do, and I actually am not sure if it's making me feeling better. I feel immediately better, but as someone who really looks to measurable outcomes to understand whether something is meaningful in the world, I wouldn't give it to a patient of mine unless I knew that its use was associated with reduction of negative emotions, or especially something like reduction of clinical anxiety or depression. We do not know that. So a tool like a Lantern product or full CBT, that is going to make measurable outcomes on clinically significant distress, and so that will have a larger effect on a fewer number of people. But the funding model there is challenging, and engagement is challenging. So Wobot's the same thing. You want to look for peer-reviewed publications like Wobot and others have that say this thing actually does affect the clinical outcomes that we care about.
Did you have something to ask? Did you, Esther? Or statement?
I'm curious, I know a little bit about this goal-setting tool for moms.
Yes, you do. It's good to see you again.
I mean, to me, that's, in a sense, far more interesting because you intervene early. You're not, I mean, you may be helping, quote, fix the mom, but you're trying to cultivate the child. And, it's like, I'm not sure we should wait to fix people.
So I'll jump on your last sentence just quickly. Prevention is absolutely the best thing we could possibly do, right? Everybody in this room, if we want to know where it's at, it's prevention. And that is important for funding as well. If we want to move the needle in the biggest way and make the biggest financial and mental health outcomes, it would be prevent the onset of disorders in the first place, right? So without even taking a specific tool that we are using at Hopelab or at all, get people to stop smoking in the first place, not start smoking in the first place, or start vaping in the first place. That's why I'm doing a lot of work in the area of teen vaping, actually, because I'm trying to prevent smoking, right, and tobacco-related disease. The problem is that the structure for how to pay for that is really challenging. So employers care about it, but you have to make a really strong argument that preventing problems in their employees is going to be more cost effective for them than treating their comorbidities, right, which are very expensive.
Well,
I'm not sure we figured that out yet.
And I think it does come back to the value-based and reimbursement model, and in which we need to have better technology to actually measure the value-based investment, in which we are able to prevent and show that this physician and this caregiver and this care system prevented depression or an opioid addiction to happen. And those technologies that are measuring those outcomes will become really important, so you can start incentivizing people who are doing the
And once
care
we
in the
change
back.
the business model
Yes.
around that, those will take off.
Yeah,
hopefully.
absolutely. And at HP, we did just implemented a new service from Crossover Health, which is a direct to a primary care on-site and near-site solution, and they have integrated behavioral health model. And so now people are getting referred to behavioral health from a trusted source, which is their primary care provider. And it's very, very destigmatized and integrated solution that people are adopting and using it all the time.
Okay, we have to go really into a break. We are so long, we are just really have extended. And so I want to bring up Anthony. And speaking of preventative care, so Anthony works in real estate, so he's going to talk just mention the workplace, and briefly mention the workplace and how the workplace can help our mental state. But Anthony, please.
Hi everyone, my name is Anthony Schell. I'm a principal with Davis & Young. I've been helping technology companies with their leases and office spaces for 13 years. Thank you, Archana. I am definitely the least smart person in this room. I'm just a broker, but I've helped over 500 technology companies from one single person all the way up to several thousand employees over the last 13 years, and so I have a little bit of perspective into how the mindset of the workplace works as it relates to mental health and overall wellness. If you've been to one of these events before, you've probably heard me talk about, at first in Web 1.0, it was purple walls and idea pain, and that was really cool and invigorating in the workplace. And then the tech world really focused on how do we recruit and retain the best talent as being the number one importance. And you began to see things like go-kart tracks in offices, climbing walls. The recent move has been into yoga rooms or mental health capacity in the workplace. But I think, and going back to the first panel discussion that we had tonight, the new wave, I feel like, and what I'm seeing from founders and my venture capitalists that I work for on behalf of their portfolio companies, is this desire for being completely vulnerable to your employees as a founder or leader, and showing if you have a mental health issue, if you are stressed, if you have something going on with you, it is about being vulnerable in the right way to your employees, about not being afraid to show your vulnerabilities. I think the phrase is thoughtful leadership in a way. So I encourage all of us as humans and leaders of people to be not afraid to ask for help or show your team and your employees that you are human as well. And anyway, I hope everyone enjoys the break. Thank you so much to Bambi and for Archana.
All right. Thank you, guys.